Hello, I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Good morning and welcome to Boomer Health at Home. My name is Maggie and I'm the Director of Nursing at AmeriStaff Nursing Services. Today we have with us Megan Gervin, a nurse and clinical nurse supervisor at AmeriStaff Nursing. Our topic today is CHF. We're going to be talking about congestive heart failure. Good morning, Megan.
Good morning, Maggie.
So tell us a little bit about yourself.
I've been in healthcare for about 14 years now. I started out as a nurse aide, nurse tech, way back in the day now. I went to nursing school at Oakland University, graduated about 10 years ago.
Okay.
And I've been working primarily in cardiac nursing at Henry Ford and in the ICUs over at Beaumont, and recently decided to cross over into the beautiful realm of home healthcare.
Wonderful. Well, we're very happy to have you.
Thank you.
So Megan, tell me, what is CHF?
So CHF stands for congested heart failure. Mainly what this means is that there is many different types, but it mainly means that you have a weakened heart muscle. It can no longer contract or pump as hard as it used to.
Okay. So what are the signs and symptoms that someone might notice?
So the biggest things that people come in noticing is that they're short of breath. They have this dry, persistent cough or a wheeze that just won't go away. They start to feel extremely tired, fatigued. They just can't have any endurance, do the activities that they used to be doing. A lot of people report that they feel nauseous, that they have a lack of appetite. A large majority of people come in with very swollen ankles, swollen legs. They start to notice that their waistband's a little bit tighter and that they're gaining weight, they're putting on weight. And in very bad cases, they start to become confused because the oxygen's just not getting to their brain anymore.
Oh, wow. Okay. So what can one do to prevent this from happening?
So like most cardiac conditions, it can be preventable. You want to live a healthy lifestyle. Don't smoke, eat healthy, don't do a lot of drugs or drink a lot of alcohol, and exercise regularly. Walking can be one of the best things you can do for yourself.
Okay, great. Is this hereditary?
It can be hereditary. Most cardiac conditions have a hereditary component. One of the biggest things you can do is actually talking to people in your family, finding out what's in your family history, and then running through it with your doctor so that they know what to be looking for, they know what to test you for earlier on.
Okay, so your familial history is very important when going to your doctor.
Very much so.
Okay. And is CHF something that's only managed in the hospital, or is it something that you can manage at home?
There are many ways you can start managing at home.
Okay.
There's a lot of online tools, but there's also a lot of different printouts that your doctors will give you. One of the biggest things you can do is to track your weight daily. Make sure you're not going up too quickly, which could be all that fluid overloading on your body that you just can't pump out and excrete anymore. Some of the biggest newer technologies is these telehealth, where you can get a tablet in your home, you can have a nurse call you every day and track your symptoms. And one of the biggest things you can do is to just stay in the loop with your doctor. Let them know your symptoms, let them know that you're starting to do a little bit worse before you get to the point of having to go into the hospital.
Okay. So Megan, I hear a lot of people that do have heart issues say, oh no, I can't have that, that's too much salt, do you have Mrs. Dash? You know, they kind of have to watch what they eat. So are there certain foods you should be avoiding?
There are many foods, that we know are bad for us. High sodium foods are definitely bad for people with heart failure. Drinking a ton of fluids, not so great either. You will tend to hold on to your fluids.
Okay.
Now, eating foods that have the good cholesterol in it can help you, and trying to avoid some of those bad cholesterol foods, fatty foods. It's a lot of what people already know about, and now there are so many different supplements out there, Mrs. Dash, and different flavors now to where it doesn't taste terrible for your salt-free options.
Great. And then adversely to that, what kind of medications can I expect to now incorporate into my daily consumption?
So the doctors will prescribe different medications based on your condition. So everybody's slightly different. There were some classic medications that are usually used, different ones called beta blockers, ACE inhibitors, and diuretics. Everybody knows about the diuretics because they make you pee a lot, right? So there are new combo medications that are on the market. They're having very good success rates with those. But your doctor may have to tweak your medications based on what you can tolerate and what's going on with you. If you have high blood pressure as well, they may add in different medications that will help you out.
And if you experience as a patient a side effect, would you tell your doctor right away? Would you wait it out for a week? What's your recommendation on that?
So depending on what your doctor told you, they may tell you you may have this side effect for 2 weeks and it may improve.
Okay.
If you're completely not tolerating the med to the point where you know you can't take it anymore, you need to notify your physician. There's so many medications out there that they can put you on something else and tweak it to make your lifestyle better, so that you don't just quit taking your meds and then don't end up doing so well and end up back in the hospital.
And what can a patient with a new diagnosis of CHF expect in their daily routine? How would it change? What would their day look like?
You have to start pre-planning a little bit better. You don't want to take your diuretic prior to going to bed, so you're up all night peeing. It's not super fun.
Okay.
So taking your medications more on a timely basis, timing them out to where you may be home for several hours after that. One of the biggest things is that you're going to be tired and fatigued. You need to be able to take rest periods. If there's an activity that you definitely want to go to, doing a rest period before, but then also having some time afterwards to where you can recoup and recover.
Okay. And how often then do you need to follow up with your cardiologist?
So sometimes at first you may have to go a little more often, which can be annoying, but as you start to get better, as your symptoms are better managed and under control, it will start to space out a little bit more. Okay. Sometimes we'll go from 3 months to 6 months to a year visit.
Okay. And I get this question a lot. Do I need to go see a cardiologist? Should it be specific, or can I see my family medicine doctor because I'm taking my husband as well and my kids? Can we all do it all at the same time?
Unfortunately, you do need to go see a cardiologist. This is their specialty. It's what they've, based their life work on, and it's something that they study. So they are more likely to know the new advancements. They've read the new studies that could help you out and actually help with your symptom management. Not to say that you shouldn't keep your family medicine or internal medicine in the loop. Mm-hmm. Everybody that is seeing you as a physician should be within the loop of care. But a cardiologist, they are your heart specialist. So.
Okay. So basically, with proper management and good communication with your physicians, you can lead a healthy, normal life with CHF.
You can, very much so.
Okay, wonderful. Well, this concludes our show for today. If anyone has any questions, please feel free to contact myself or Megan at AmeriStaff at 248-288-2270. Thank you. Have a great day.